Hey everybody, Dr. Vaughn here with Ask Dr. Vaughn. Let me turn the phone around so I can see your comments and questions and see who's joining us. Boy, a lot of people. I'll just go ahead and put this up and you can see that we are at Lisa's birthday party. Actually, it's not just hers, it's Lisa and several friends, well, two other friends having birthday, but I thought we'd do a little Ask the Doctor because, yeah, it's nice to see a pretty view around. And you guys might have some questions. So Gen 3, thanks for joining. Everybody else that joined, thank you. Jay Ramsey, thanks for joining us. We're glad to have you here. And we can go ahead and get started as soon as anybody has any questions. Or if anybody in the live audience has questions here. I guess you guys are live there too. Yeah, this place is kind of nice. It's in our town here, and you can find it on VRBO, Vacation Rentals by Owner in Auburn, California. And it's called the Cottage Pool House. If you guys are interested in visiting out here, it's a pretty cool place. Miss Brassic, thank you. Princess Mish, thank you. 1221 dot Kurt Sturts 1, thanks. A lot of familiar faces or familiar names. So we're glad to have you guys here. And we're glad to have the hearts. Boy, you guys give me hearts. I haven't even done anything yet. Some of you may have joined us earlier today. We talked about some interesting topics and had some really good questions. Oh, good evening, Princess Mish. Thanks for being here. Being Gowie, thank you for joining us. We're glad to have you too. I was quite surprised at the number of new people who are followers after this afternoon's Ask Dr. Vaughn. That was, wow, very pleasant surprise. Thank you for telling your friends. That was really cool, those of you who did that. And in case there's anybody here who isn't already a follower, you can swipe right and follow and share with your friends if they think be interested in talking about medical topics. Kay Sturts, health doctor. Yes, I am a health doctor. Okay, here we go with the first question. Aspirin or acetaminophen, which is better? Well, they are different enough that they each have their own areas that they excel in. But if it's for trying to just get down a fever or addressing a pain, I always recommend Tylenol first, except for in those very rare individuals who have a problem with their liver. Maybe somebody who has an alcohol problem or who is taking medicines that are hard on the liver or has had a problem with drugs or has a liver disease, they would not want to take the Tylenol. But everybody else, hey, go ahead and take the Tylenol. Take up to 3,000 milligrams a day as long as you don't have any of those problems and you and your doctor know that you don't have any of those problems. It's good for both fever and pain relief. Now, there's some types of pain that people find it just doesn't quite do the job and they'll want to use other medicines for you. Oh, somebody asked about the t-shirt, but let me finish up with the aspirin first and then I'll show you the t-shirt. Aspirin is very good for some things and in fact is the most recommended medicine for some things, one of them being pericarditis. Aspirin is one of the medicines that you'd want to use almost first line for that, if not first line. It is an anti-inflammatory, like non-steroidal anti-inflammatory drug, so it does have benefits of reducing inflammation. Oftentimes I'll use the other NSAIDs or non-steroidal anti-inflammatory drugs like ibuprofen or naproxen instead because they're easier, somewhat easier on the stomach. Okay, now time for the shirt. This is the Turkey Trot from 2013, I believe it was, in Davis, California. It was, I think, my second 10K I ever ran, maybe my first 10K I ever ran. Okay, and also aspirin. Yes, somebody broke about the 81 milligram aspirin. Aspirin is an excellent medicine for reducing risk for heart disease in people who have some kind of risk factors for it. It used to be that we'd recommend it for everybody over age 50. That's no longer the case. Now it's just people who have some kind of risk factor for heart disease, because if your risk of having a heart attack or stroke in the next 10 years is 5%, or less, you're not going to expect to get much benefit out of taking your aspirin a day. In fact, you may even be at more risk with it because it is a blood thinner, and if you're in trauma, you don't want thin blood, you want to be able to clot. Shout out to Rock. Why, are you in Rockland? Do we have somebody from Rockland following us? We don't usually have local people watching us. Let's see here. We've got Mike Zamani. Thank you for the shout out to Rockland. Be sure to follow and share with your friends who are local so that we can get some local following here. Has the Affordable Care Act affected your practice? Or as you wrote it, the Affordable Car Act, which would allow me to get to work for a lot less money. But no, it's the Affordable Care Act, and it does affect our practices in good ways and bad ways. The bad way is that patients have difficulty paying for their insurance or have really high deductibles. That's not so cool. But the really good thing about it, though, is all the preventive stuff is covered and patients don't have to pay a copay. It doesn't come out of their deductible. So there's no reason for them to not come in and get an annual checkup and get their, I don't know how much of the preventive labs and mammogram and things like that are covered. I should know the answer to that. but it is a chance to get in and get all those things looked at. It should get looked at by the doctor once a year without having to pay any money out of pocket for that. So for that reason, I really like it. And I expect that that kind of work is going to, in the long run, cost us less money for our health care. I also think that if people actually do all get the insurance, the young, healthy adults who it's intended to get, if they all get the insurance, then the cost should not go up as fast as it was before the Affordable Care Act. And I want to say it that way rather than say price go down, because we never really anticipate getting the price of health care down. That would be an incredible victory if we're able to do that. Just keeping it from going up and accelerating in the cost increase that was going on before the Affordable Care Act, that would be a victory in itself. And so I encourage people who are critics of it to remember how fast the prices were going up, the cost of health care before the Affordable Health Care Act went into effect. And it certainly is not perfect. But after all the court hearings, it looks like we're kind of stuck with it. We need to modify what we have to make it the best. And that's what I encourage everybody to do and encourage our leaders to do. Can you add me? Yes, please. Swipe right and follow. You swipe right on your screen, or I guess for you it would be that direction. And then Kim from Rockland. Cool. We're glad to have you on. And the Swag Monster has joined us. Advice to reduce pressure caused ear pain on a plane. And hello from Yo Big 777. Hello. The pressure when you're on a plane. First of all, it shouldn't be a problem if you're trying to pop your ears, and it's more of a problem when you're landing than when you're ascending. It's when you're descending. You want to pop your ears as much as you can as you're starting your descent. Drinking something can help. And then if you're really having a problem, or you have a cold when you're going, you may want to consider using some decongestants if it's okay with your doctor. And maybe even an over-the-counter nasal decongestant that I never otherwise recommend, like Afrin or Neosynephrine. Those things are horrible for causing people to get addicted to nose sprays. But if you're just using it for the landing in the plane to open things up to help reduce the risk of the air squeeze, that's where they may have some usefulness. Again, I recommend check with your Dr. Devick 666. Thanks for joining us. Yeah, Sudafed would be the oral antihistamine. And again, you have to get those from behind the counter at the pharmacy, at least in California, and they're not for everyone. People with high blood pressure shouldn't take it.